To release our bulletin at this hour, the Health Department says it's ready to deal with any possible outbreak of the coronavirus. Health Minister Dr. Zweli Mkhize has assured South Africans just a short while ago that measures are in place to ensure early detection of the virus. There are no confirmed cases in South Africa. The outbreak has claimed over 130 lives in China and has spread to several other countries.
Provinces have activated outbreak response teams and are on high alert to detect and manage inadvertent cases that may arrive in the country. Screening of returning travelers from China at major airports have been intensified. I'll also go into a little bit of details in this regard, as this is, of course, an area of paramount concern. Our port health officials routinely conduct temperature screening for all international travelers. Those of you who have been traveling abroad could have noticed that we have a thermal screening, which is conducted at a distance, and that everyone actually coming through from international travel gets subjected to this routinely as they land at the OR Tambo and the other airports. However, due to the current risk of importation of inadvertent cases of the coronavirus from Wuhan city, our port health authorities have intensified surveillance of all travelers from Asia.
Dr. Mkhize is advising South Africans not to travel to the city, that's Wuhan in China, unless it's critical.
The guidelines have not recommended any restrictions on travel and trade, but it is recommended that non-essential travel to Wuhan city in Hubei province should be avoided or postponed. Prospective travelers can monitor the situation and plan their travel accordingly. Our understanding is that currently Wuhan city is essentially quarantined and 5 million citizens have been evacuated. Chinese authorities have closed all public transport entering and leaving Wuhan and other areas in Hubei province. South Africa has responded rapidly to ensure that the coronavirus does not become a national threat. As a department, it is standard procedure to monitor emergent outbreaks, and we are currently tracking a plethora of pathogens, including those viruses of pandemic potential like H5N1. We also then wish to reassure that coronavirus is no exception. We're working very carefully to ensure that we track everything around this virus.
South Africa will not evacuate its citizens currently living in China. Dr. Mkhize says the Department of International Relations and Cooperation has been assured that no such action is needed.
We've received a number of queries regarding the safety and health security of our citizens living in China, particularly those in Wuhan city and Hubei province. A meeting was convened by the Chinese Foreign Ministry with diplomatic mission on 27 January 2020. In summary, the government of the People of the Republic of China has assured us and reassured us that there is no evidence to support the necessity to evacuate foreign nationals living in Wuhan city, and they have called for calm in this respect. All persons entering or leaving Wuhan are subjected to a 14-day quarantine to ensure that they do not develop symptoms. Foreign nationals who need medical assistance for whatever reason will be treated like Chinese citizens and be afforded all the medical care that is necessary in that area. Embassies are also enabled to support those locked out and locked inside Wuhan. And in our discussion with the Minister of International Cooperation, Dr. Naledi Pandor, she indicated that DIRCO is aware of at least 35 South Africans in Wuhan city, and they are in touch with the citizens who are there as well as the authorities, and therefore if there's any need to respond or to do anything, they will be in a position to judge that. At the moment, they believe that we just need to monitor that situation.